Hello, my name's Sam. I'm an osteopath who's just about to finish my MSc in Musculoskeletal Healthcare and Rehabilitation. So, what is this weird trick that can fix your shoulder pain? As you may or may not know, context always matters with your pain experience, but of course there are biomechanical tips and tricks they can manipulate so they can feel less irritation. So what actually is shoulder impingement? Well, it's actually quite an outdated term, and actually the research community is probably moving towards less harmful sounding or less specific terminology. And you may hear that it's now more referred to as subacromial pain syndrome or rotator cuff related pain syndrome. And essentially, whatever it is, it's the space between the shoulder blade, that is the acromion, and your arm bone, that is your humerus. And that's so between the acromion and the humerus, there's a space there which can easily get kind of irritated, inflamed, called outchie, whatever you want to call it, it's hurting, just that little subacromial space. But enough of that, what's the fix? Well, biomechanically speaking, Pain and Voigt summarizes the movements quite well. So they describe the scapula and the humerus moves upwards into flexion, right? And there's an over relationship where it's a split between 2:1. So for every 2 degrees of humeral flexion, so when the arm bone moves 2 degrees, there's going to be 1 degree worth of scapular upward rotation, right? So the arm bone will probably move double the amount of the shoulder blade as it comes up, roughly speaking, okay? So there's 4 main movements of the scapula when it comes to moving your arm upwards, okay? And we've got these 4 movements. One is called upward rotation. So let's say my phone is the scapula. So we're looking at the scapula from back to front. So what upward rotation is that it kind of comes up like that as your arm comes up as well. So it kind of comes up like that. Something called posterior tilt, and what posterior tilt is that the scapula actually tilts backwards like that, actually tilts posteriorly. Okay, so I've got a little video ahead of this video that might explain a bit more. And then we have something called external rotation, which is like this kind of plane. And then we even have something called protraction as well, which is almost like punching with a straight arm, that kind of movement. So you've got like there's a lot of movements in the scapula, which is it's very these kind of subtle movements of the scapula, which you have to consider alongside our overhead arm movements. Now you have to remember that there are 17 muscles, I think some texts quote 18, attached onto the scapula. So you really have to appreciate that the muscles around the scapula would have to work together in harmony for efficient and nice motion. If for some reason these movements don't come into play, you run the risk of irritating that space more than you really should. And there's some pretty sensitive structures in there, like the bursa or the rotator cuff tendons. So the theory is, with some evidence, it suggests that the lower trapezius and the serratus anterior are the ones to blame most of the time. And the lower trapezius is the portion of the massive kind of trapezium shaped muscle at the back, and the lower portion of that, which extends all around to around say T12, that portion of the muscle gets a little bit weak, potentially. Arguably that's what the research says. And of course the serratus anterior, which are these kind of muscles, which is sometimes referred as the punching muscle. So sometimes you see boxers and they have to see these kind of feather-like muscle kind of a definition on their side. That is the serratus anterior, and that main function is to protract the shoulder or punch. So I have a diagram here that shows the motion of shoulder movement. So as it goes into flexion, you can see the shoulder blade comes up with it, roughly around here. So you can now start to see the shoulder blade, which is this thing here. It comes up around the rib cage and moves upwards like that, okay? And a lot of people just tends to forget that the shoulder blade is involved with the shoulder movements. So the fix is, as we move our arm upwards, I'd like you to think of moving the scapula up with the humerus. Actually have some conscious effort in elevating that shoulder blade particularly when your arm goes beyond shoulder height. So when your arm kind of roughly comes around here, I really want you to think about lifting your shoulder blade, rotating up with the humerus. Okay, so you can see here the shoulder blade comes up and rotates around. And annoyingly, the animation just stops there, but of course you can probably imagine the shoulder blade will just rotate even higher upwards as the humerus goes beyond shoulder height. Another thing I'd like you to think about is also tilting the shoulder blade backwards. And what does tilting mean? So the posterior tilt I refer to is that, imagine this part here, the shoulder blade actually comes backwards, so kind of towards the screen, so we're tilting towards that way. Imagine it's kind of falling backwards. That is what I mean by posterior tilt. So that movement in itself is involved with arm elevation past 90 degrees. So we've got these two movements at the moment. So we've got upward rotation, which is the easiest one to see, which is this gross movement coming up with the humerus. And then you've got a very subtle one which you can't really see in this animation, but just imagine that the scapula is kind of falling back on itself. It's tilting backwards, that posterior tilt. And then we have something called external rotation of the scapula. So the scapula externally rotates, it outwardly rotates. So imagine now, as best you can, the shoulder blade is coming out like that. So if I'm the model here, the shoulder blade is here, is coming out like that. This is the humerus, this is the scapula. As I'm moving my arm upwards, of course we see the scapula moving upwards as well, and we have a little bit of posterior tilt, and then we have some external rotation as well, and that kind of axis, okay, as you're moving your arm up. And I'd like you to think of those three movements, okay? So we've got one more to go over, which is protraction, and protraction is that shoulder blade kind of moving around that rib cage. So if we just go back to the animation, so the protraction is kind of like that. There we go. You see how it's kind of moving around the rib cage as well, smoothly. It's quite a tricky thing to kind of visualize, but the more you practice all of these kind of four subtle movements, I'm sure we can expand that space as much as we can, or rather maintain that subacromial space, just so we can limit the amount of discomfort. Okay. So here's a little kind of fun activity for you to play around with. So with rotator cuff related pain syndrome, a classic sign is something called the painful arc syndrome, and that's basically when you move your arm into abduction, you get a little bit of pain, or maybe a lot of pain halfway through, around 60 to say 120 degrees, so roughly from here to here. That tends to be painful, and then after that 120 degree mark, it tends to get a little bit better. In fact, it probably goes away completely. Okay, so this little game I'd like you to play is that as you're moving your arm upwards, just before the pain starts, I'd like you to think of those four movements. Okay, so we've got upward rotation, so we're going to move that shoulder blade upwards as well. We're going to think about posterior tilt as well, so you may not see I'm doing it, but I'm trying to tilt that scapula backwards. And then we have external rotation, so we're just trying to bring it out like that, so we're externally rotating the shoulder blade. And then we have protraction as well. And if you think of those four subtle things as you're doing it, that really maintains that space between the shoulder blade and the humerus. So if we go back to the diagram, the space I'm referring to is here. That is the space, that is the subacromial space. You can see that if the scapula didn't move, let's say the scapula didn't move, that arm bone is definitely going to kind of irritate the structures within this little space, i.e. the bursa, the rotator cuff tendons, or anything that can live in that area, right? And those structures can be quite sensitive. So the idea is the shoulder blade has to move along with the humerus. Okay, I know it's a little bit tricky to kind of get your head around sometimes. It definitely was for me. But just think of, if I were to prioritize any movement, it will be the upward rotation of that scapula. So as it's moving up, the scapula moves up along with it. Going back to that game, when you find that little bit of pain, when you incorporate those four movements, i.e. upward rotation, tilting it back slightly, turning it outwards, and even protracting it, that should actually theoretically reduce the discomfort, because you're actually providing a little bit more space in that subacromial area, right? And then just try to maintain that, or even increase those motions as you bring your arm up like this. So at the moment I'm thinking a lot on my shoulder, but I'm thinking about the upward rotation, I'm thinking about the posterior tilt, I'm thinking about the external rotation, I'm thinking about the protraction as well. And then as you come down, you just simply maintain that kind of support from the scapula as you come down as well, rather than letting the shoulder blade just fall down and then let your arm drop down. Because a lot of the time when people bring their arm down, it kind of pinches halfway, but you want to maintain that kind of tension around that shoulder blade in order to maintain that subacromial space and not reduce it. So another tip for you is supporting the collarbone or the clavicle, this bone here. And now the collarbone is a very interesting bone, as it's the only bone that links up between the shoulder and the thorax. So this is the linking bone between the scapula essentially to your manubrium, which is your basically middle of your chest. And what's going on is that you can probably tell this has implications to shoulder movements, because so as I move up and down, you can see the clavicle actually moves as well. So if I move from up here, you can see subtly from here the clavicle starts to move, and that movement essentially, it actually gets higher elevation. You can see it gets higher, it moves upwards, and sometimes that can get a little bit lazy as well. And if that gets lazy, it can actually impact the space, that subacromial space. When you're moving your arm up and thinking about those four things, i.e. upward rotation, posterior tilt, external rotation, and the protraction as well, you can actually use your opposite fingers and put it just underneath that collarbone and actually push up with it. So you're actually pushing that collarbone up, and it actually does hurt a little bit as you're doing it, but what that does, it just supports your movement moving higher without again maintaining that space, right? And then as I'm moving the arm down, I'm still pushing up just to make sure it doesn't drop down too soon, and actually it just frees up that shoulder a little bit, okay? So if you employ these strategies with your shoulder blade and your collarbone, and being more mindful of these two bones as you move your arm above your shoulder, you can manipulate the orientation of the shoulder such that it maximizes the amount of subacromial space, therefore minimizing irritation to those sensitive structures I mentioned, such as the bursa, rotator cuff tendons, which tends to be the culprit. The more we practice different positions with these movements, the better we're going to be with pain-free movement. Try it out for yourself. Let me know what you think. If you'd like more videos about tips and tricks on moving better and managing your pain, please don't forget to like, comment and subscribe. Thank you.